Hi, my name is DJ Talabi, and I am the nurse educator of the TCB program. And I'm going to be going over the step-by-steps on how to insert a clean intermittent catheter into a male patient. So the first thing that we want to do is we want to wash our hands. And we want to wash our hands because washing our hands limits bacteria and kills germs from entering into the urethra and limits the potential of getting a UTI. So the first thing we want to do is wash our hands with soap and warm water for at least 20 seconds. After we wash our hands for 20 seconds, we want to gather all our supplies together to start the process. So the things we would need to catheterize are the catheter that we will use. I first wanted to show us the catheter that we use in the hospital. So if you were a patient in Burke, you're probably familiar with this catheter, and this catheter is the Vapro Plus catheter. But at home, you're going to be using the Vapro Plus Pocket, and I'm going to show you how to catheterize yourself with this catheter. But these catheters are essentially the same thing, and some form of cleaning agent. So we recommend some type of wipe or towelette. You can get this from the local store, or if you can't, you can use a washcloth with soap and water. So the first thing we're going to do is open up the package. There's a circle here that you can put your finger in, and you just pull down to open the catheter. And this system is a closed system. And what I mean by closed system is that every area that's going to be inserted inside of the penis is currently closed or is protected. So the tip is covered with the cap, and the catheter itself is protected by a sleeve. So in other words, you can just place it down and it is still sterile. Next thing we want to do is to prepare the penis. So we're going to use our towelette. And the way we clean, we want to make sure we first identify the opening of where the catheter is going to go, which is known as the meatus or the urethral opening. So we want to clean in such a way that we want to remove bacteria away from the meatus. So we want to clean with one part of the towelette, use another side, and continue to clean away. You're going away from the meatus, down the glands, once again using another area. Okay. Now after we clean, then we want to get our catheter, so we'll unravel the bag. And then when we're absolute ready to start the catheterization process, then we'll take off the cap. But before that, you want to hold the penis firm, and we want to hold it at a 45 to 60 degree angle. This will enable the urethra to be straight, which would allow or promote easy passage of the catheter into the bladder. You don't want to squeeze the urethra so that it will make inserting the catheter much more difficult, and we don't want that. You don't want to take off the cap until you're ready to insert the catheter into the penis. So now we're going to start the process. So once, like I said before, you're going to hold the penis with your non-dominant hand. In this case, I'm left-handed, so I'm going to hold it with my right hand, and then we're going to take off the cap. And then we're going to insert the catheter. And then we're going to go in slowly until we notice urine. If you meet any resistance, sometimes it's just a matter of the direction of the penis or the catheter itself, so you can just maneuver the penis to straighten it out more, and then try once again. We will know we're in the bladder once we start to see urine flow. And you can see here that the catheter is in the bladder, so we would continue to allow the bladder to drain, and we know that the bladder is empty once the urine flow stops. Once the urine flow stops, then we'll start to remove the catheter slowly. If when removing the catheter you notice drainage starts to reoccur, you just wait, let it drain, and then empty slowly. And then we just remove out until the catheter is all the way out, and then we remove. Then you'll notice that there's a demarcation area that says tear hair to empty. So at home, you can just tear it and then just pour it into a bowl. And that's the step-by-step process on how to catheterize in a male patient. As Lorianne mentioned as well, it depends on your physician on how frequent you would catheterize. Typically, it's 4 to 6 hours. We don't recommend using the same catheter over and over. These are one-time usage, so once you use them, you throw them away, and then when you have to cath again, you open up another kit. So I just want to go over some of the common complications that are associated with catheter insertions. The most common is a urinary tract infection, which we know as a UTI, and that's why we are so big on washing our hands. Washing our hands limits germs and kills bacteria, and that's why we also emphasize that we don't want to open up the cap until we're ready to insert, because once we open it, the closed system becomes an open system. So we open once we're ready to cath. And then more so commonly in men than in female are strictures. Strictures essentially is just a narrowing of the urethra, and that becomes a problem down the line because the narrower the urethra gets, the harder it is to pass a catheter. And that's why I want to quickly go over this specific type of catheter. This type of catheter is called a Coude catheter, and this type of catheter is more commonly used with patients who have enlarged prostates. And the unique thing about this catheter is that in comparison to this one is that you can see that this catheter is straight and this one is curved. And the purpose is that when you insert it, the curvature of this catheter promotes passage past the prostate into the bladder. So if you ever get to a point where you're starting to regularly have difficulty passing the catheter with the straight catheter, you might want to start to speak to your physician, and they can start to do workup, and they'll test to see if your prostate is enlarged, and you would probably do better with this catheter because of the curvature. And it's important to note that when you're going in to the penis, that you want to go in with the curvature up. So it's the same process. You will wash your hands, you will wash the penis, but the only difference is that you would go in with the curvature up. And that's all, and you would follow the same to drain the bladder. And then some of the other complications that are associated with catheterization are bladder infections, perforations or spasms, kidney infections, and all those still are barring down to making sure we're keeping our hands clean, making sure the catheter is sterile, washing our hands, and all these things will help prevent UTIs or any form of complications in catheterization.